Teaching learning theory. The next major guideline we are going to consider is teaching learning theory, which identifies that motivation is the key to successful client teaching. The nurse must first determine that the client is motivated to learn to care for his or her own health care needs. This would indicate learner readiness. Another part of assessing learner readiness, once the nurse is assured that the client is motivated to learn, is assessing the client's ability to learn. Just a few of the things that the nurse must determine include: is the client able to learn cognitively, emotionally? Is the client free of pain or other distractions? Is the environment conducive to learning? Has the client received prior teaching on this topic? Or is this the first introductory lesson? This crucial action necessary to make certain that the nurse's teaching plan will meet the client's needs. Remember that the most carefully constructed teaching plan will not do any good if the learner is not motivated or ready to learn. Let's take a look at a priority question that would require us to use teaching learning theory to eliminate distractors and choose the correct response. First, let's separate the case scenario from the stem of the question. The case scenario tells us that the nurse is preparing a female client with severe depression for electroconvulsive therapy, known as ECT, to be performed the following morning. The stem of the question asks, which action does the nurse take first? Let's identify the critical elements. The key words are severe and first. The client is the client with severe depression. The issue is the client preparation for ECT therapy. The stem of the question is a true response stem. Now we can start to look at and eliminate distractors. Again, this is a good example of priority question, where at first glance not only do all the answers look right, but they all are actions that the nurse will need to take to prepare the client. We will assign question marks to all of them, since we know that every one must be done. You need to decide which action is the one that the nurse takes first. Let's look at option 1. Determine if informed consent has been obtained. We know that ECT treatments are usually administered under anesthesia and are considered a procedure for which informed consent is required. But can informed consent be obtained before the client is fully informed? Remember also that the obtaining of the consent is the responsibility of the healthcare provider who will be performing the procedure. The NCLEX exam is about nursing, so always focus first on the client's nursing needs. Option 2. Ask the client if she has any questions about ECT. At first glance, this appears to be an assessment to determine if the client is motivated and interested in learning. However, look again at your case scenario. This client is severely depressed. It is unlikely this client has the energy to formulate a question. If you ask the client this question, she is likely to say no, or even more likely to simply shake her head no. This question should be asked, but at the end of the teaching, to evaluate the effectiveness of the teaching. Remember that at the termination of any teaching session, the client should always be asked if they have any questions. Now, let's skip ahead to choice 4 for a moment. In choice 4, explain that she will be anesthetized during the procedure. We know that ECT treatments are usually administered under anesthesia, and this is information that is considered an important part of the teaching plan. However, it does not help us to assess the learner for learning readiness or motivation. Let's look at the remaining choice to see if it provides an opportunity to assess the learner. Option 3. Determine if the client has had ECT treatments before. This is the only option that focuses on the client's teaching needs. If the client has had these treatments before, the teaching needs may vary considerably than if the client has never had an ECT before. With only the information in this case scenario, you all know that The client needs ECT. In this teaching learning question, we now have two probably wrong choices, choices 1 and 2, one possibly correct answer, choice 4, and one probably right answer, choice 3. So now we should go with what we know and select choice 3 as the correct response. Ready to try one on your own? Here is a sample priority question. In this drill, I want you to practice using teaching learning theory to set priorities and eliminate options. First, separate the case scenario from the stem of the question. The case scenario tells us an infant with feeding difficulties has had a gastrostomy tube placed and will be discharged on gastrostomy tube feedings. The stem of the question asks, in preparing to teach the infant's father how to feed the baby, the nurse plans to, first, identify the critical elements. The key word is first. The client is the infant's father. The issue is teaching the infant's father gastrostomy tube feedings. The type of stem is a priority response stem. Next, we can look at and eliminate distractors. Option 1. Provide the father with a handout to read prior to the teaching session. This option will be assigned a minus sign. Although we know that providing handouts helps to reinforce the teaching plan, simply providing one to the father without first assessing his readiness to learn is unlikely to contribute much to the teaching plan. Option 2. Allow the father to feed the infant while providing instruction. This option will be assigned a minus sign because this action puts the cart before the horse, although we know that return demonstration with the assistance of the nurse helps to reinforce the teaching plan. Simply having the father feed the infant without first assessing his readiness to learn will increase his frustration and lead to a poor outcome. Option 3. Offer to show the father how the feeding is done so he can watch. This option will be assigned a question mark. We know that this would be a good introductory action to take in our teaching plan, but we are still looking for a choice that indicates learner readiness or allows us to assess the learner. In option 4, inquire of the father what he already knows about feeding his baby. We can assign a plus sign to this choice. This is the only choice that allows the nurse to assess the learner's needs. It is possible that the father has already observed several feedings and feels ready to do more at this point. Or it is possible that the father has no knowledge about the feeding tube at all. The only way to obtain this information is to assess the learner. In this teaching learning question, we now have two probably wrong answers, choice 1 and 2, one possibly correct answer, choice 3, and one probably right answer in choice 4. So we know to go with what we know and select choice 4 as the correct response. Okay, I think that you are ready to use your new knowledge of multiple choice question test-taking strategies to be successful when answering the drills in the following questions. Be sure to use the strategies based on the principles and guidelines we just discussed. Maslow's hierarchy of needs, therapeutic communication principles, nursing process, and teaching learning theory. Okay, here is a sample question. In this drill, I want you to practice eliminating distractors using the priority setting strategies we just learned. All right, let's see how you did. First, let's separate the case scenario from the stem of the question. The case scenario tells us that the nurse is writing a nursing care plan for a schizophrenic client admitted with extrapyramidal side effects from Haldol. The stem of the question asks, which of these nursing diagnoses included on the care plan does the nurse indicate takes the highest priority? Second, let's identify those critical elements. The key word is highest. The client is the client. The issue is the extrapyramidal side effects from Haldol. The stem of the question is a priority response stem. Now we can start to look at and eliminate those distractors. Here is another good example of a priority question where at first glance not only do all the answers look right, but we know that they are all nursing diagnoses that apply to this client. We will assign question marks to all of them, then decide which nursing diagnosis is the one that takes priority. Choice 1, impaired verbal communication. Certainly, we know that the altered thought process common to schizophrenia are often manifested as impairment in verbal communication. Clients may demonstrate a variety of abnormal speech patterns. However, this nursing diagnosis relates to the client's medical diagnosis of schizophrenia, not to the issue of the question, which is the extrapyramidal side effects of Haldol. Let's look for a nursing diagnosis which better relates to the issue of the question. Choice 2, altered thought processes. Certainly we know that altered thought processes are common to clients with schizophrenia. Clients may demonstrate a variety of abnormal thought patterns, including delusions and hallucinations. However, this nursing diagnosis relates to the client's medical diagnosis of schizophrenia, not to the issue of the question, which is the extrapyramidal side effects of Haldol. Let's look for a nursing diagnosis which better relates to the issue of the question. Choice 3, impaired physical mobility. We will assign a plus sign to this choice. We correctly identified that the issue of the question is the client's extrapyramidal side effects from the Haldol, rather than the client's medical diagnosis of schizophrenia. Extrapyramidal manifestations include muscular rigidity, bradykinesia, and tremor, resulting in impaired physical mobility. In addition, this choice represents both a physiological and safety need, therefore a basic need according to Maslow. Option 4, sensory perceptual alterations. This choice represents both a physiological and safety need, therefore a basic need according to Maslow. Certainly we know that the hallucinations that are common to clients with schizophrenia are alterations in sensory perception. However, this nursing diagnosis relates to the client's medical diagnosis of schizophrenia, not to the issue of the question, which is the extrapyramidal side effects of Haldol. Let's look for a nursing diagnosis which better relates to the issue of the question. In this priority question, we now have two probably wrong answers, choices 1 and 2, one possibly correct answer, choice 4, and one probably right answer, choice 3. So now we should go with what we know and select choice 3 as the correct response. Ready for another? Okay, here is another sample question where you will be eliminating distractors using the priority setting strategies that we just learned. Start by separating the case scenario from the stem of the question. The case scenario tells us that the nurse is working in the emergency room when a child comes in following ingestion of kerosene, a substance containing hydrocarbons. The stem of the question asks, the nurse knows that the priority assessment of the child is. Let's identify the critical elements. The key word is priority. The client is the child. The issue is priority assessment following hydrocarbon ingestion. The type of stem is a priority response stem. Let's look at and eliminate distractors. This is a good example of a priority question where at first glance, not only do all the answers look right, but we know that they are all assessments that apply to this child. We will first assign a question mark to each choice. Then we need to decide which nursing assessment is the one that takes priority. Let's begin by looking at option 1, visual acuity. A minus sign will be assigned to this option. Hydrocarbons are found in natural gas, petroleum products, and coal. Children can be poisoned as a result of swallowing these types of products, such as gasoline, kerosene, and paint thinners. blurred vision may be an initial finding in this type of ingestion, but at this point it is not the priority assessment. Option 2, burns of the mouth. We will keep the question mark on this choice. Burns of the face, mouth, and esophagus may be the initial findings of hydrocarbon ingestion, but this may not be the priority assessment. Option 3, gag reflex. We will assign a minus sign to this choice. Small quantities of hydrocarbons can easily get into the lungs and damage them directly, leading to severe aspiration pneumonia. The nurse would not want to stimulate vomiting by assessing the gag reflex, and this could increase the risk for developing aspiration pneumonia. Option 4 will be assigned a plus sign. Immediately after ingestion of even a small amount of this type of poison, the child will cough and choke. Breathing then becomes rapid, gasping, vomiting may occur, and persistent coughing may follow. Because chemical irritation will increase irritation, treatment for this may include oxygen therapy, ventilator support, IV fluids, and careful monitoring. In severe cases, brain damage may occur. Neurological symptoms such as drowsiness, stupor, coma, and convulsions. In this priority question, we now have two probably wrong answers, choices 1 and 3, one possibly correct answer, choice 2, and one probably right answer, choice 4. So now we should go with what we know, and by remembering our ABCs, we will select choice 4 as the correct response. Are you ready for another? Okay, here is another sample question. In this drill, I want you to practice eliminating distractors using the priority setting strategies we just learned. All right, let's see how you did. First, let's separate the case scenario from the stem of the question. The case scenario tells us that the nurse enters the room of a client with a chronic alcohol problem and finds the client shouting, "Get those ants out of my room." The stem of the question asks, which nursing response is appropriate? Second, let's identify those critical elements. The key word is appropriate. The client is the client with a chronic alcohol problem. The issue is response to the client's hallucination. The type of stem is a true response stem. Now we can start to look at and eliminate distractors. Option 1, tell me more about the ants. We will assign a minus sign to this response. We recognize that the client is experiencing a hallucination, and it is inappropriate to say anything that would convey to the client that the nurse shares the client's hallucination. Option 2, the ants you see will not harm you. We will assign a minus sign to this response. We recognize that the client is experiencing a hallucination, and it is inappropriate to say anything that would convey to the client that the nurse shares the client's hallucination. Option 3, I don't see any ants, but you seemed frightened. We will assign a plus sign to this response. We recognize that the client is experiencing a hallucination, and the nurse acknowledges the client's feeling, the fright, the experience. Option 4, I don't see anything. This is part of your illness. We will assign a question mark to this response. We recognize that the client is experiencing hallucinations, and the nurse knows it is inappropriate to say anything that would convey to the client that the nurse shares the client's hallucination. However, a more appropriate response would acknowledge the client's feelings, the sense of fright, the sense of fear at the experience. In this communication question, we now have two probably wrong answers. Options 1 and 2, one possibly correct answer, choice 4, and one probably right answer, choice or option 3. So now we should go with what we know and select option 3 as the correct response. Are you ready for another one? Let's try again. Okay, here's another sample question. where you will be asked to practice eliminating distractors using the priority setting strategies. Let's separate the case scenario from the stem of the question. The case scenario tells us that the home health nurse notes several suspicious bruises on a 10-month-old child while making the initial home visit. The stem of the question asks, the priority nursing action at this time is to identify the critical elements. The key word is priority. The client is the 10-month-old child. The issue is several suspicious bruises. The type of stem is a priority response stem. Now we can start to look at and eliminate distractors. Option 1. Call the Child Protective Hotline and report a possible unsafe situation. This will be assigned a plus sign because the case scenario comes right out and states that the bruises are suspicious. As nurses, you know that we are mandated reporters of any suspicion of abuse. According to Maslow's hierarchy of needs, the client's safety is a basic need. Option 2. Discuss the findings and family situation at the next team meeting. Certainly we would want to discuss any suspicions at a team meeting. However, remember you should always be looking for the most client-centered response. According to Maslow's hierarchy of needs, the client's safety is a basic need. Is there another choice that would be better to promote the child's immediate safety? If this child is being abused, can we afford to wait until the next team meeting? Option 3. Tell the mother that if the child has bruises at the next visit, it will be reported. Certainly we would want to discuss any suspicion with the mother as part of our assessment of the situation. However, remember you should always be looking for the most client-centered response. And according to Maslow's hierarchy of needs, the client's safety is a basic need. Is there another choice that will promote the child's immediate safety? Option 4. Carefully document the location and bruises appearance in the client's chart. Certainly we would want to document any findings, but remember you should always be looking for the most client-centered response. According to Maslow's hierarchy of needs, the client's safety is a basic need. In this priority question, we now have 2 probably wrong answers, choices 2 and 3, 1 possibly correct answer, choice 4, and 1 probably right answer, choice 1. So now we should go with what we know and select choice 1. This is the correct response. Ready for another? In this drill, I would like you to eliminate distractors using the priority setting strategies. Begin by separating the case scenario from the stem of the question. The case scenario tells us that the nurse is preparing an 8-year-old male child for a bone marrow biopsy to be done later in the morning. The stem of the question asks, which of the following actions does the nurse take first? Identify the critical elements. The key word is first. The client is the 8-year-old child. The issue is preparation for a procedure. The type of stem is a priority response stem. This is a good example of priority questions, and at first glance, by looking at the options, they all seem correct. We will assign question marks to all of them and then decide later which action is the one that the nurse does first. Let's begin with option 1. Ask the client if he has any questions. Look again at your case scenario. The client is an 8-year-old child. It is unlikely this client has the previous experience to formulate any question except, will this hurt? Remember that at the termination of any teaching session, the client should always be asked if they have any additional questions. Option 2. Explain that he will be medicated for pain during the procedure. We know that a bone marrow biopsy is quite painful and is typically done under conscious sedation. However, it does not help us to assess the learner for learning readiness or motivation. So let's look at the remaining choices to see if they provide an opportunity to assess the learner. Option 3, stress the sensory aspects of the procedure. We know that when preparing children for procedures, it's very helpful to give them sensory information. However, this choice does not help us to assess the learner for learning readiness. Let's look at option 4. Determine if he has had a bone marrow biopsy done before. This is the only choice that focuses on assessing the client's immediate teaching needs. With only the information in the case scenario, all you know is that the client needs preparation for the test to be done today. In this priority question, we now have one probably wrong answer, choice 1, two possibly correct answers, choice 2 and 3, and one probably right answer, choice 4. So now we know to go with what we know and select choice 4 as the correct response. Let's go on for another one. Here is another sample question where you will practice eliminating distractors using the priority setting strategies. Let's separate the case scenario from the stem of the question. The case scenario tells us, a hospitalized client with a known history of coronary artery disease suddenly complains of left chest pain. The stem of the question asks, the nurse's initial action should be to. Let's identify those critical elements beginning with the key word. The key word is initial. The client is the client. The issue is left chest pain in a hospitalized client. This type of stem is a priority response stem. Here is another good example of a priority question where, at first glance, not only do all the answers look right, but we know that they are all nursing actions that would be appropriate in this type of client. Let's examine option 1. Call the client's physician. This option will be assigned a minus sign because you do not have all the information you need before taking this action. Remember, before you intervene, nursing process says you must first assess. Let's look at choice 4 next. Administration of nitroglycerin. Certainly, if the client is experiencing a serious cardiac event, they may need to receive nitroglycerin. But you do not have all of the information you need before taking this action. Remember, before you intervene, the nursing process says that you must first assess. This is a very good distractor. But look at your case scenario. The client is in the hospital. If the client was in the community without a nurse right there, this might be the right choice. However, because the client is in the hospital, we will assign a minus to this choice. Option 2, obtain a blood pressure and pulse. We will assign a plus sign to this choice because it is an assessment action that focuses on the client. With only the information in the case scenario, all you know is that the client has a history of coronary artery disease. The client may be at risk for side effects from nitroglycerin such as hypotension. Let's take a look at other choices to make sure that there is not a more important assessment action. Option 3, do an electrocardiogram or EKG. We will assign a plus sign to this choice because it is an assessment action that focuses on the client. With only the information in the case scenario, all you know is that the client has a history of coronary artery disease. Let's now look at the options that provide the nurse with important assessment information to determine which is the initial action. In this priority question, we now have two probably wrong answers, choices 1 and 4, and two possibly correct answers, choices 2 and 3. We know that the most important assessment parameters on any client are the pulse and blood pressure. So now we go with what we know and select choice 2 as the correct response. Let's summarize where we are. Before going on, let's recap what we have already learned. The third step in ATI-TQ logic is application. In this step, we learn decision-making skills and strategies that are absolutely essential in providing safe and effective client care, which can be used when answering complex problem-solving questions. To help you to make judgments and set priorities, you may use the following principles and guidelines to analyze facts and situations and apply nursing knowledge. The first principle is Maslow's hierarchy of needs, which tells us that the client's basic physiological needs come first. When there is more than one physiological need, remember your ABC principle, in which case airway needs come before all others. In the absence of physiological need, consider any safety concern first. Next, nursing process identifies that the nurse must always assess first. In communication theory, the nurse must first address the client's feelings, and teaching learning theory identifies that motivation is the key to client learning. However, I cannot stress enough that you should only use strategies when you are unable to set priorities and answer the question with your nursing knowledge alone. Your best strategy is to always go with what you know. Now, let's look at how all 5 phases of the nursing process can be used in nursing exams to assess your knowledge of nursing concepts.